All good to go? Yeah? Oh, sunglasses. Hey. It is noisy, isn't it?
Yes, good, thanks. Thank you.
Okay. It is great to be here in Wynnum today at the Collective Store in the electorate of Lytton. We have 31 new cases today. That's 109 active cases and a cumulative total of 2,258 cases since the beginning of COVID. Another interesting figure is that we have seen an increase of 30,000 border applications overnight. Everyone wants to come to Queensland, which is great, and you can't blame them. I'm going to hand over to Dr. Gerard to give the details on those figures I just gave you. Then we'll go to the Police Commissioner, and then I want to come back to you and talk to you about local businesses. Thanks, Dr. Gerard.
Thank you very much. Sorry. Just bear with me a second if you wouldn't mind. Okay. As expected, the number of cases we are seeing in Queensland continues to increase. 31 cases in the last 24 hours, which is effectively a 50% increase from yesterday. Although these numbers seem small, in a percentage-wise, they are increasing steadily. And in addition, we know there are cases that we will not be diagnosing that are in the community. This is what we expected. We expected that in the coming weeks, we are going to see very large numbers of cases of COVID-19 in the community. What I can say is that of the cases we have in hospital at present, and these most recent cases, none are seriously unwell. None are seriously unwell. Cases have been seen across the state. These include Cairns, Darling Down, Gold Coast, Brisbane North, Brisbane South, Sunshine Coast and the Townsville region. The specific locations will appear on our website in the coming hours. 2 were overseas acquired and detected in quarantine, so are not a concern. These cases were in Cairns. 8 are contacts of known cases, and some will have been in home quarantine. 5 are linked to interstate travel and would not have been in quarantine. 1 case caught the virus in Queensland community, and we do not have a link to another case in that case, and there are 15 cases currently under investigation. We test also to see which patients have the Omicron strain of the virus. We don't get these results until a day or 2 after the cases are diagnosed. Again, this number has increased to 12. We expect the Omicron strain to become dominant in Queensland in the coming weeks. In addition, I can say that there have been some cases in the healthcare setting. Because we are aware that the virus is widespread, it is inevitable that people in the healthcare setting will develop infection, and that is going to happen more and more in the coming weeks and months. So there are a number of venues, healthcare venues across the state, where there have been either staff or visitors with COVID-19 in them. These include the Northwest Private Hospital in Brisbane, Toowoomba Hospital, Princess Alexandra Hospital, Blue Care Homefield residential aged care facility in Mackay, and at least 1 general practice in Brisbane. This will continue to occur in the coming weeks and months. Remember, there are thousands of healthcare workers in Queensland, so it is inevitable that some of them will get infected. Now, All of our healthcare workers are vaccinated, and all of our healthcare workers wear masks when in the clinical environment. So the risk to patients is minimised, but it does emphasise the need for all of us to get vaccinated. We now have a national plan for dealing with the healthcare workers when infections do occur in the healthcare setting, and these are being followed in all of these cases. But this is inevitable, and this will continue as the epidemic progresses. What else can I tell you? So what I would ask everybody is to continue to get into the habit of checking the exposure sites on the Queensland Health website to be aware of where cases are occurring in Queensland.
The cases within hospitals and facilities, are they of particular concern? Obviously they're going to happen, but does it concern you that we'll see more and more of those?
We will see more and more of those. The main thing is that Queenslanders need to get vaccinated. What we are seeing, and I will tell this to you, with the Omicron strain in vaccinated people, we are seeing that sometimes they have, or often they have no symptoms. So if you are vaccinated, and I know that 90% or almost 90% of you are, you may well not be aware that you are carrying the virus. So this is something that everyone needs to be aware of, and that's another reason why those few remaining people who haven't been vaccinated need to get vaccinated now.
On the case in the Toowoomba Hospital, we understand it was a worker in a maternity ward. Are you able to give any more detail on that?
All I can tell you is that we have a system now in place for dealing with cases such as this, a nationally agreed system, and appropriate measures have been taken. Any contacts have been spoken with, and the case would have been managed appropriately.
And with all the increased testing numbers in this week with the borders now being open, is there any strain on testing supplies or anything?
Not at this stage. Yesterday there was a detailed plan that was presented to the team to deal with the increasing testing that is being done. I do know there is strain interstate where they are seeing large numbers of cases locally, and the requirement to get tested before coming across the border, that does put a strain on those states, but we're trying to keep Queenslanders safe.
Just to clarify, can you just run over how many active cases we've got at the moment and how many of those are vaccinated?
The number of active cases, I don't have that figure here on my so. Sorry, a second. I do not.
Thank you. Good morning, everyone, and welcome to the Bayside. The Queensland Police Service is extraordinarily pleased with the high level of compliance with the check-in measures under the new mandate in the last 24 hours. We had 22 complaints, calls for service in terms of individuals, and some 36 in terms of businesses. But when the police arrived, those patrons have left. And also with the businesses, it was a general education, piece that we did with them to make sure that they comply into the future. It has been disappointing to hear there have been a couple of instances where people have abused staff, and that was at a business in Strathpine, but also a person quite belligerent trying to get into one of the hospital's ICU units. He was not the patient. So we will continue our high activity in this space, more compliance, more controls, and work with more businesses into the future. As I've always asked, please be patient, be kind. Businesses are abiding by the law. I ask patrons to also abide by the law. But from my perspective and a policing perspective, it has been an incredibly pleasing result in the last 24 hours. I just want to give you a sense of some of the numbers coming through the borders at the moment. Since the borders opened up on Monday, there have been 136,948 GV applications, close to 1,000 international applications. The traffic on the M1 last night was quite slow. There was an hour of delay there, and that has opened up this morning. In the last 24 hours, we've intercepted 36,941 vehicles. 239 of those have been turned around. 1,681 heavy vehicles, 12 of those turned around. 153 flights from a hotspot in the last 24 hours, and 6,993 passengers subjected to confirmation checks. 12 were refused entry, and 101 people were put into quarantine from a hotspot. And what we're finding, and what has been alluded to, that some of those are just not getting their PCR test results in time, so they go into quarantine until those results come in. Remember also, the mask mandate is in place. Overnight, we've handed out 199 masks, and we will keep doing that. We'll keep having a real compassionate and educated approach to this. But as always, in terms of what we've done throughout the entire 2 years of dealing with COVID, we will take a compassionate approach, but if there is blatant disregard, obviously we will take enforcement action in those times. Any questions?
In terms of that compassionate approach, we've seen a lot of businesses come out over the last couple of days blatantly saying that they're not going to enforce that mandate. Where does the line stop in terms of, I guess, teaching them a lesson and being compassionate?
So what's happened in the last couple of days, we know those businesses, they've been quite public, and in fact a number of those businesses we've gone to with the Queensland Health Department and spoken to them about their obligations. Many of those businesses have changed their attitudes, and we've given them a little bit of latitude, and if over the next 24 hours, for the next couple of days, if they haven't obviously complied, they will be issued with hefty fines, and I am talking about fines of $6,800 and above.
Commissioner, yesterday the first, it was 5 days since the first one that came across the border. Are police checking that day 5 test requirement now? How do you enforce that requirement?
So the day 5 test, and I'll get the Cho to talk to this because it is more his area, it really is, it's a trust issue here. We expect cooperation from the public, and not just from a health perspective, but a policing perspective, for people to do the right thing. In terms of our compliance checks, it is the law, and we support that. So people are doing the right thing. I've got to say, the last 24 hours have been incredibly pleasing. We have literally seen businesses who have said that we're not going to do this are now complying. A couple of difficult patrons, but mostly people trying to do the right thing. But this has been a relationship with the community all along. So to Queenslanders and those coming into our state, and I'm giving you the numbers, tens and thousands, a sincere thank you, because to this date, what has held us in great stead is the cooperation between the public and all of the authorities.
Will police continue to go back and check in with those businesses that have been?
Yes, so police will constantly go back. Interesting, not only the police, as you know, the media have been checking in with some of those businesses as well. And as I said, where a number of businesses were very vocal about not being compliant, that has changed. I will say that if it doesn't change, there is a certain amount of latitude we will give you to get this right. But at the end of the day, it is the law, and you can't blatantly disregard the law. It is there for a purpose, and we will make sure that action is taken.
Are you anticipating a big influx of people coming through our borders, obviously next week?
We are. In fact, over 30,000 applications for the GV pass, and that's from the hotspot areas just last night. So the numbers are increasing dramatically, probably far more than what I'd expected. 136,000 just in the last 6 days.
We've seen a few cases spike in Byron Bay, which is quite respiratory. Is there any changes or concerns with what's going on?
So that's monitored daily, and I know with the health department, Queensland Health will make a decision on that into the future. All of those areas we keep a close eye on day in, day out, and if changes need to be made, they will. But as I said, on the roads, in terms of compliance, please be patient. The signs are all out, even in the business behind us. Be kind. These laws and directives are in place for a very good reason. And all in all, I'm incredibly pleased with the reaction of the public and businesses over the last 24 hours.
Some of those changes that you just said, we want to look at some of those changes.
So in the past, and I actually should let the Cho talk to this, but obviously in the past, if there is concerns about some of those areas, they become a hotspot and they're treated very, very differently. So I'll let him to talk to it, but I'm sure that we will keep on monitoring that situation.
Sorry,
Yes.
we're expecting a protest again in Brisbane this afternoon. How do police approach this? We see it almost weekend after weekend. Extra resources, I imagine.
So there are protests planned for a number of areas across Queensland, and in fact it's a coordinated protest across the nation. Disappointingly, we see a minority of people doing the wrong thing here. So we've always taken a approach that we will facilitate protests, if need be, and we should certainly support that. But what I ask is that people in those protests even do the right thing. And it's always the minority that make it very difficult for us in the public. So please do the right thing, respect the law, and hopefully in the next few months we all get back to a little bit more normality.
Are you concerned as a pro and an anti-vax rally at the same time as there's response and concerning that there could be heights?
So often we see pro and anti-vax rallies take on at the same time. What we've seen is a high regard of respect for each other. They do their protest and they move on. The protests have been very compliant and very respectful. People are out there having their say, and can I thank them for that? A sincere thank you, actually, because we don't want to get into some of the situations that we've seen elsewhere. We work with these groups to facilitate them getting their views across. But at the end of the day, it's respect by everyone and making sure that we do the right thing.
You want to ask it?
Yes, it changes nothing at all. We are expecting to see thousands of cases in New South Wales and across Australia and ultimately Queensland. So we have no plans, no intentions of closing borders again, no intention of closing any borders.
And in terms of testing as well, we've seen testing sites really start to get those delays again with people going back. We're going to get any more places or longer hours?
We review this on a day-by-day basis.
And just quickly, back to the national plan for health workers who will end up inevitably getting COVID. Do you have any details of what that would entail? Because I feel like people would be worried about going to hospital and then catching COVID while they're there.
The point is, hospitals are like everywhere else in the community. The COVID, you must assume that COVID is everywhere here in Queensland, everywhere. It could be on this street. It could even be among you here now. You may not know it. It is spreading throughout Queensland. It's expected, it is inevitable, and it is necessary.
Will we ever see exposure sites not on a list anymore?
Yeah, ultimately that would be the intention. We've not reached that point yet.
I guess as well with that as well, case numbers, when are we going to move to a point where we have to report the numbers of people in hospital as opposed to how many we're seeing daily?
Yes.
Inevitably going to see.
Yes, almost certainly in the coming weeks. But I will emphasise again, at this stage we have no one seriously ill in hospital, including any of the Omicron cases. But our numbers are small. But I think it's almost inevitable, almost certainly because of the amazing vaccination rates we've seen. And just again on the compliance thing, I just do want to thank everybody. I've been out and about, and you just see masks everywhere. It's fantastic to see that everyone is following the rules, and it's just great that Queenslanders are doing this, and that will slow down the spread of the virus and allow people to get that third dose, particularly those that are vulnerable in the coming weeks, before we see the peak of this current Omicron epidemic, probably sometime in January.
Thank you. Well, it's a day since we've started the new normal with businesses and patrons following vaccination mandates. And can I just say an absolutely huge congratulations to those businesses. We know that a lot of businesses were really worried about doing the right thing, about patrons doing the right thing, and they have been absolutely magnificent about making sure everything was in order and done as it should be. And we have heard so many stories yesterday about patrons who have gone out of their way to make sure that it was easy for business owners and staff to check their vaccination status, and yet again Queenslanders have risen to the occasion and just done an absolutely great job. So thank you to all of those people who've really made that extra effort yesterday. But now we turn our minds to how else we can help small business, and today is 1 week until Christmas. And if you're like me and you haven't done your Christmas shopping yet, then you have some very serious work to do. And can I suggest that you actually look local to do your shopping? We have 1 million small businesses in Queensland, and they're not just figures on a page, they're our neighbours and our friends and our family members, and really in the 639 days since COVID restrictions were put in place for small businesses, they have really done the hard yards for us. They have borne the brunt of the restrictions, and now is the time when they can really make the most of that. So this is a time when we say thank you to those small businesses. You've done the hard work now, and we're going to support you back. Everyone has got their favourite local business, so head down there today or in the next week. Don't leave it too long, and do a big spend there. Think about the people in your local community who are business owners who could really do with that thank you. Can I also just say a thank you to Queenslanders for what they've done about the mask wearing mandate as of today. Queenslanders have shown since the outbreak of COVID that we know how to do the right thing. And in fact, even since June this year, we've actually had 50 outbreaks and we've handled it so well. So we know what to do with this. We're seeing the COVID figures. We know that that we're now living with COVID. It's a new normal. So please, you know what to do. You wash your hands, you socially distance. If you feel sick, you go and get tested, and then you stay at home until you get your negative test results. We can do this. We look after each other. That's what Queenslanders do. I'm going to hand over to Joan Peace, who's the very proud member for Lytton, and then we're going to talk to Belinda, who owns the collective store.
Thank you very much, Minister, and welcome to the beautiful Bayside. I'm really proud of how Baysiders have responded to COVID, and equally proud of our business and small business owners. We've got over 4,000 small businesses in the electorate, and each and every day they'll go out and support each other, they support our community. They're always the first to put their hand in a pocket to support a local charity or a local school. So I'm incredibly proud of the great work that they do and how hard they have worked during COVID. None more so than Belinda here at the Collective, but all of our local small businesses, and we are really fortunate here to have some of the best, well, I believe the best small businesses in Queensland. So I'm going to make sure that I do all of my Christmas shopping starting today, and like the Minister, I haven't done any of mine yet, and I'm looking forward to going out and supporting all of my local small businesses as they've supported all Queenslanders and all Baysiders during COVID. And I'd like to introduce Belinda from the Collective store. She's wanted to say a few words. Thank you for having us this morning, Belinda.
No, you're very welcome. I'm very grateful to have everybody here at the Collective store this morning. We have over 100 local creatives that make our products that we sell. So get down and support local, definitely. It's a big thing for all of the families, all of the Queensland families to receive your support this Christmas.
Last year, when we've had lockdowns and a lot of sort of uncertainty, what's it like being a small business owner during that period?
Yeah, it's definitely been challenging. We've had amazing support though through the whole period from the local community and the government. So we're looking forward to getting some normality back into our lives. But it has been a big challenge, that's for sure.
How are you finding the swapping the changes?
It's easy. I think we're used to it now. Like, I think I've got about 14 masks, so it wasn't very hard to come back to that. I think we're very used to it.
And are people quite compliant with coming into your store?
Yeah, definitely. You can see this morning everybody is coming in with a mask, and even prior to the mandate announcement yesterday, people were looking out for each other and wearing masks.
How do you prepare yourself, you know, you come across someone that you've got a police and people that doesn't want to wear a mask. How do you prepare yourself with these changes and trying to run a business as well?
Yeah, I think you just have to refer to the rules, and we're all trying to do the right thing. Obviously there will be cases where that people will want to not follow the rules, but we just come from a genuine perspective and let them know what we need to enforce, and most people are happy to do the right thing.
Just get your full name,
I was
please.
about to say, can you just spelling your first name?
Oh, Belinda Richards. Yeah.
Spelling of it?
Oh, Belinda.
Yeah.
Belinda Richards. Fabulous.
Thank you, everybody.
Thank you.
questions?
So while you're here, go down and look around the shops. We've got lovely shops. This is just one of them.
Yes, there's
surrounded.
lots of local amazingness around.
Thank you.
Thanks so much for coming.